Hello everyone, I'm Dr. Elizabeth Thompson, Academic Director for the National Centre for Integrative Medicine in Bristol in the Southwest. Thank you to Anna Moreira for asking me to speak at this conference, and I'm going to share with you about developing and delivering a new diploma, Master's Level 7 diploma in Integrative Medicine. We wanted to tell you more about that. But first of all, I'm going to share my screen and tell you a little bit about the National Centre for Integrative Medicine. We're really excited to be part of this movement for change. And we're a small not-for-profit social enterprise. So all of our profits go into developing both education and clinical services. And we want to support a transformation of healthcare through education and building a like-minded community. Crucially, we want to inspire health and well-being with a model of wellness at the heart of what we do in healthcare and finding balance in our lives. And these are things that many of us want to do, either to prevent illness, but also if we have developed a condition, to try and work with a very broad approach to see if we can improve symptoms or even sometimes underlying disease processes. So all of you, I'm sure, will know by now that integrative medicine is bringing together conventional lifestyle and holistic approaches to support health and well-being. Wellness and resilience are core concepts, as is optimizing health and reducing disease risk. Importantly, it is an empowered model offering diversity and choice to patients and clinicians. And I know that many of the healthcare professionals, CAM practitioners that have joined us on the diploma are really excited to be breathing new life into their clinical practice. So there are lifestyle programs, but why might complementary therapies be important within the conventional lifestyle and holistic arena? Well, it was very interesting developing this master's level course, because we would look at traditional Chinese medicine, naturopathy, homeopathy, some of the whole systems that have gone back in time for many hundreds of years, some of them. And so we're really keen to draw on science and the evidence-based, but also on philosophies of health, which may be touching on something deeply felt by humanity over the generations. And the idea that the body is wise and might know what it needs, but doesn't always have the space to connect to it, is a key part of holistic consulting. So looking at these other approaches, they offer complexity, depth, quite often going into more detail, with issues and themes around finding balance, wholeness, rejuvenation, and healing. So within the diploma, we do look at a whole range of approaches. So within the design, it's Master's Level 7. That does mean a lot of critical analysis and studying the evidence base. It's Ofqual regulated and accredited by Crossfields Institute of Higher Education in the UK. It has been blended with face-to-face and online learning, but with COVID, we've moved everything online. And it involves 120 credits, so that's 1,200 hours. So roughly around 8 to 10 hours a week. So when people do commit, we have the 8 modules, and I'll talk more about that, and 3 three-day intensives, 2 days of which are just diploma students, and then a third day where we open up to the larger community and have focus days. Like our last day was about child health. In February, it's about men's health. And all of this is available on our website if you wanted to check through what we're up to and whether you might like to join our scientific network, where you get discounts on all our teaching, and also whether you might like to just see what's going on. So with a modular program, in the first year, you look at philosophy, history, the changing times in medicines, then integrative medicine approaches and conditions. In other words, I've talked about these range of approaches. It might be green care, nutrition, functional medicine, around 18 approaches, but then we start to look at conditions like diabetes, musculoskeletal health, you name it, it's in there. So it's extremely relevant to your clinical practice. I'm the lead for holistic consulting, and this, I believe, lies at the heart of anything we do, building the therapeutic relationship, looking also at how we activate and motivate people into change, and change management can be a challenge. We also look at IM called 704, which is research and critical appraisal, and that launches in the February of the first year. In the second year, we continue ideas around holistic management, connecting to social prescribing, and we also have elements of dynamic practice, setting that up or being part of an existing practice, and leadership skills, which can be an important part when you're creating change, both that kind of inner leadership, finding out what direction you're going to take, and then sometimes that translating into what you might do in the world. Then another big module led by Dr. Duncan Still, looking at integrative medicine approaches and conditions, this time going into more detail with conditions. And there's also an element around innovation in integrative medicine and self-care. And we've designed it, I think, to feel very full and complete, and really does graduate you into, I hope, a sense of confidence and experience with integrative medicine skills and knowledge. So it does include so many elements, and that's part of the excitement. And we have, as well as our core tutor team, we have our associate tutor team from the UK and around the world, all experts in the field that they might be specializing in, so that you within your tutorial program, which in the first year is busy every week, but we record them and you can watch again. And then in the second year, the tutorial program continues, but quietens down a little while you're completing assignments. Within NCIM, we're excited that one of our graduates has joined our holistic